So now for a condition often discovered during adolescence, which is idiopathic scoliosis. That's a lateral curvature of the spine with vertebral rotation. So for findings, we will see a visible curve of the spine where it will look like an S shape like here. Because of that curve in the spine, we will see asymmetry, so it looks like they have uneven shoulders or hips. And if you remember from gym class, they may have asked you to bend over to test for scoliosis. That is because when they bend over, you will see an apparent rib hump due to that spinal curvature. So adolescents are in that Erickson stage of developing a sense of identity. So remember, peer interaction and appearance are really important to these clients. So as nurses, we need to encourage peer interaction and discussions of feelings because they have this obvious alteration of body image due to the spinal curvature. So for moderate curvatures, they will have to wear a scoliosis brace over their torso. And these braces we need to teach are worn to prevent but not correct the curvature. So by now you've probably guessed it. Any client wearing a medical device like a brace or a cast, we're worried about those two things, skin integrity and circulation. So they need to wear a shirt under the brace to protect that skin. Then they need to monitor for skin integrity and circulation regularly. Lastly, if they have a severe spinal curvature, they need a spinal fusion surgery. So during that surgery, major blood vessels can shift and cause compression of the bowel, so we're worried about bowel obstruction. So if we see signs like vomiting or epigastric pain, we need to report those immediately. So our last NCLEX quick check, take a moment to answer these questions. What non-pharmacological interventions help JIA exacerbation? Well, remember, that's like rheumatoid arthritis, so the treatment is similar. We need to apply compresses and give warm baths to reduce that joint pain, and we splint joints to reduce the risk of contractures. Then, which activity is appropriate for clients with JIA, basketball or walking? Well, remember, basketball has a lot of jumping and that can be hard on those joints. So we want low impact activities like walking. The client should not wear anything under the scoliosis brace. True or false? Well, remember, we want to protect that skin under the brace, so we definitely want to wear a shirt. So this is false.